I am not Dr. Polly. I am sure that you have seen pelvic floor physical therapists online talking about why they love being a pelvic floor physical therapist, or maybe this is your first introduction to a pelvic floor physical therapist. I'll first tell you that I am not a traditional pelvic floor physical therapist, and this is something that I feel like is true about me because I definitely do things very differently than many of the other of my colleagues across the country. Now, let me first tell you that going to physical therapy school was such a dream. It was a dream that I had ever since I was a freshman in high school. And when I graduated physical therapy school, I quickly realized that helping women with pelvic floor issues was something that I felt very called to do. In fact, when I was on one of my rotations, I thought that I was going to be helping women after their cancer care. Turns out I was doing a lot of pelvic floor care, and I was, dare I say, traumatized, and it was not what I was wanting. But I realized that these women that were struggling with intimacy and really feeling like their bodies, that they weren't doing what they used to do, or their bodies felt very unrecognizable to them, or they even felt like their body just didn't work. And it was so incredible to me to be able to watch these women transform from feeling so confused and frustrated to be able to be in a position where they felt like they did before they had kids, where they could be one of the few of their friends saying, well, I can jump on a trampoline without peeing your pants, and can you? And the women who felt like their marriages were able to be improved and really come back to life after struggling with pain with intimacy for so long. It was truly an honor and a privilege for me to be able to provide them answers and the help they needed in order to get to the point where they felt confident and proud of that body, even after having kids. And I quickly realized that this particular job of mine was very different than helping someone after they had knee surgery or they had hip pain or back pain. There was a lot more, that this dug a lot deeper into their heart, into really how they felt and how they saw themselves as a woman, which to me, I strongly believe in that quote from Nelson Mandela when he says, if we want to change the world, then we need to help the women. I'm sure I didn't say that exactly right, but I know he said something to that effect. And I really do consider it an honor and a privilege to be able to help women in this phase of their life, because it's quite silly to me that women are struggling when there are answers. And some of these answers are really quite easy to implement and to perform. And so when I started this video, I said, I am not Dr. Polly, and I am not a traditional pelvic floor PT. And let me tell you why. There are many of my colleagues and other pelvic floor PTs across the country that like to refer to themselves as Dr. So-and-so. And while there is a lot of meaning behind being called doctor, I personally don't choose to be called that for a lot of different reasons, and I'll just share a couple of them with you. First and foremost, one of the things that I disliked and I disagreed with was how formal everything had to be as it related to patient care or taking care of the patient in these specific issues with pelvic floor. Now, while there has to be a strong level of decorum and professionalism, I also felt that these women, and you yourself might be included in this, that you were coming to me and sharing with me things that you had never shared with anyone else. And I wanted to, well, I should say this. What I quickly realized was that being called doctor didn't fit that situation. It was almost like I was, dare I say, one of their trusted friends and confidants. A friend or a lady who they could tell anything to, and they knew that it would never be repeated and that there would be no judgment. And I quickly realized that women in this scenario that were coming to me just struggling and feeling like they were alone and feeling like they had nowhere else to turn, that pelvic floor PT was their last resort, for me, that burden felt semi-heavy, but I also, on my end, felt so much hope because I knew that I was able to help provide them the answers that they were looking for and help them return to the body and the function that they wanted. But one of the many things I quickly realized as I was working with these women is that I don't want to say it was a friendship, but it felt like friends. And I never want to be perceived as someone being superior to you, because the way I see it is that I just happen to be a gal who went to physical therapy school, who chose to go down the route of treating the pelvic floor, who chose to devote her life to helping women get the answers that they need and to help return their bodies back to the way they were pre-baby. Not someone that's sitting here and trying to, I don't know the best way to describe it. It didn't sit well with me. And that was something that I decided pretty early on that I did not want to ask my patients or anyone around me to call me Dr. Polly. Now, while I have my doctorate in physical therapy, just like many of them do, to me, the degree is not the focus. The focus is on you. How can I help you reach your goals? How can I help you be in a position for you to stop leaking and be in a place that you can say yes to playing with your kids in any moment of the day? You don't have to go change your pants. You don't have to go put a panty liner on. You don't have to go to the bathroom first. You don't have to withhold water, but you are now in a position because you're the hero of the story. You're the one who will have done the work to be able to get to where you need to go. I'm just the one giving you a few little directions. Think of me as Yoda, maybe. And that was something that I wanted to shift the focus, not on me. I feel like there's a status or something when we say Dr. So-and-so or Dr. So-and-so. And while I'm not trying to take that away from anyone, I just personally felt like I wanted you to be the hero of the story, and I wanted all of our efforts and focus to be on you, not on me. My job is to know the right things to say, the right exercises, the right planning, the right strategy to help you reach your goals. Your body is the one that we are focusing on, and that's just kind of how I felt about it. Another reason that I don't like being called Dr. Polly is because I think that personally there is a lot more to me than what I do. Now, while it is a huge part of it, I actually really have a hard time turning it off. In fact, when I play with my kids sometimes, the other day we were doing hopscotch and we were trying to come up, my daughter and I, we were trying to come up with different ways of how to do this particular hopscotch, different patterns. And she did this particular pattern, and I thought, oh my gosh, that's a really incredible way to tax that pelvic floor, and it fits in what I like to call the VAB3 principles that live inside my No Kegels University method. But anyways, my brain's always going, but I also think that there's a lot more that I'm a mother, and I'm a wife, and I have chickens, and I have 3 dogs, and those are also where my love and attention goes. And because of my experiences that I have, there's so much more to me and my life experiences that I think that I bring to the table. And what I mean by that is when I think about the patients that I was helping before I was a mother, the type of programming and the logic was very different than after I became a mother, because I quickly realized that mothers don't have a lot of time to themselves, and when they do, it's very sacred time, right? Like, what do we want to be spending this time alone doing? And so that is honestly in part where part of No Kegels University was born, because I needed to figure out a way to make everything very concise, to make everything very efficient, but to make it effective too. And so while Dr. Polly could fit me, I also feel like, well, Mama Polly and this part of my perspective is playing a lot into where this programming is coming from and how I'm now able to help women strengthen their pelvic floor in 10 minutes, 4 to 5 days a week. And for me, watching these women and these mothers realize that they weren't having to do 20, 30 minutes of exercise where it was such a production, that they were able to have something that was effective and efficient. And in fact, making these exercises and programming that I was doing for them very efficient and concise, it actually yielded quicker results. And a lot of that was just because of my perspective as a mother. Now, I also have 3 dogs, and a couple of years ago we bred one of those dogs. And if you follow me on Instagram, or you're a patient of mine or a coaching client, I would be highly surprised if I never mentioned our yellow lab, June B. And June B taught me so much about birth and delivery. And interestingly enough, my experience helping her birth a couple of her puppies at home and then having to take her to the urgent care and have it was a whole thing. She ended up having a C-section, and watching her nurse, but also watching her recover after she had a C-section, and what, dogs and her natural mama instinct wanted to do was to move. And so I changed quite a bit of what I was doing to be able to reflect that natural instinct that we have. And it was interesting to see that even I had expressed and felt some of those same natural instincts after each of my births. And when I spoke to some doulas and some midwives and brought this perspective that I had, it was really interesting to see how their perspective also added to that. And that perspective was that our bodies are designed to move. Our nerves like blood flow, space, and movement. And the postpartum body is not designed to be stuck in a bed trying to figure out nursing the entire time. Yes, we should figure out nursing, and we should be able to figure out how our baby needs to sleep. But I also think that we need to move and allow this body of ours, after we did something so miraculous, to move. I like to think of cows and horses because I grew up watching horses give birth and being around farm animals where they were not stuck in bed, they were not stuck in a stall. In fact, mama and baby did great when they went outside, and the mom horse was able to run around. Same thing with cows, same thing with sheep. And so again, I don't want to be called Farmer Polly either, because that's not a good fit. But this particular perspective, by encouraging my patients to move and to really hone in on the first 2 to 3 weeks of birth, that has changed their progress and their outcomes so much more than what I was having them do before. Now, I could keep telling you about my experience in pageants. I could tell you about my experience when I was showing my horse at the World Show as a youth. I could tell you about all sorts of things and how that has played a role into my programming and my logic. But what I can tell you is that my heart has gone into creating No Kegels University and the programs inside it for your benefit. Because while there's a lot of parts of my life that have contributed to this, that part still doesn't matter. What matters is that this programming, these programs that I have, make a huge difference and help you stop leaking, have pain-free intimacy, and return to that pre-baby body without Kegels. And if I haven't said this enough, you are the hero of the story here. You are the focus. And I don't want to take away any of that on my end. I really just want to be the one that's giving you suggestions, giving you and teaching you the method, and however it is that you want me to play a role in your progression back to that pre-baby body, I am here for it. Now, if you call me Dr. Polly, I'm not going to be mad. Again, it's your story and you're the hero of it. So I'm hopeful that by sharing a couple of pieces of my life and how it's translated into this particular program, that you can see it. There's part of this that's meant to be a joke and it's kind of meant to be funny and light. But again, my focus is you. I want you to win and I want you to succeed. And I want you to know, first and foremost, that it's possible for you to be proud and confident about that body even after having kids. And secondly, if you're willing, I would love for you to come along with me and for you to experience feeling confident and proud of that body even after having kids. Now, I would love for you to go ahead and fill out a form on my website where I can give you your pelvic floor or core's next step. This particular form, it should only take you a couple minutes to fill out, and I will personally send you a written response as to what I think your next step should be. If you're ready to dive in even further, please go take a look at some of my programs inside No Kegels University. Two of my favorites are Your Pelvic Floor Your Way. It's a DIY program that you're able to decide and to create on your own based on the principles. And I would also encourage you to look at Bye Bye Leakage. There is so much information packed in there, and I have recently added 30 days of one-on-one support from me to that particular program with your purchase of it. So with that, remember, you're an heiress and a queen and everything in between. See you next time.